Good afternoon, everybody. Welcome, welcome, welcome. So today I'm really excited you're all here. So it's a little bit of a crazy thing. I'm supposed to be at work today, but we had a little bit of snow and I have a little bit of nanny issues. So I am actually doing this from home, which is the typical place that we do this when we're in the evening. But I was planning on doing this one during the workday, thanks to Compassion First, which is the fabulous company that I work for, and they love to support me, talking to pet owners and educating them about cancer. And so really excited this month we are going to be focusing on mast cell tumors in dogs. I got some questions that I have that were from yesterday, and we will jump on, but hopefully as some people will hop on, we can get more questions and answer your guys' questions. So first off, where is everybody from? Is anybody else dealing with snow as we are in the Northeast? This nor'easter was not so bad exactly in my area, but definitely hit Long Island where my parents are, and they were coming up to take care of my kids today. So a little bit of a crazy day. So welcome everybody. If you want to, in the comments, just so I can make sure I have all my technical difficulties that I typically have worked out, why don't you guys tell me where you're from in the comment section, and we will get going very soon with your guys' questions. We have a couple of housekeeping things too. I want to tell you when we'll be doing our next live Q&A. Hey Heather, welcome in North Carolina. Had a small dusting. Sunny in Florida, so definitely envious for my friends who are in places with warmth, sunshine, and palm trees. A couple of weeks I will be someplace sunny and warm, so I'm very excited. Hey Michelle, how are you? Great to see you here. So again, we have some people hopping on, and we are going to get going in a few minutes because mast cell tumors is definitely one of these cancers that there is so much to talk about. Hey Ariel, welcome. So grade 2 mast cell tumor, medial carpus, bad margin, c-KIT negative, radiation not an option. Next step. Great, and you're from Pittsburgh, so welcome. I'm actually going to be in Pittsburgh this weekend. I'm speaking at the Western Pennsylvania Veterinary Medical Association on Sunday. So I'm flying out Saturday and then flying home Sunday and then back in the clinics on Monday. So Ariel, that's a great question, and we will definitely talk about that. Hello, Kiem. Your pup goes in for your second chemo, vinblastine for mast cells. So as you guys can see, this is a really common cancer, and there's lots of questions. And it's definitely a tumor that I say one size does not fit all. And what do I mean by that? I mean that, my parents' dog, I mentioned yesterday in the live announcement for this, the reminder, their dog had a very aggressive mast cell tumor. So some of these tumors are very high grade and aggressive, and some of them are low grade and curable with surgery, and they won't metastasize or spread, and the dogs can do really, really well. So, if your dog has a mast cell tumor, there's lots of things that we want to figure out about them, so we can really tailor treatment to them. So a couple of things before we dive into mast cell tumors. So our next live event will be in the evening at 9 p.m. Eastern, 8 Central, 6 p.m. on the West Coast in the Pacific time zone, and we're going to do that on Thursday, April 19th at 9 p.m. So that's going to be our next live question and answer. At this point, I am thinking that is going to be on mast cell tumors as well, because again, common cancer, lots of questions, and I'm just not sure how much we're going to get to. And so we'll probably be doing that for the rest of March and into April. So what my goal was for each month was to focus on a cancer. So in January, we talked about dog lymphoma. And then in February, we talked about cat lymphoma. And if you guys are looking for those Q&As or this Q&A, you can either, scroll through them on the Facebook page, but an easier place to find them is on my YouTube channel, Dr. Sue Cancer Vet. And so there's a playlist of all the Q&As. And again, you can go back and look at the ones that we were doing on all tumors or one on a specific tumor. So we're going to throw a link in the comment section where you can, for the YouTube channel and where you can find it. If you subscribe to it, you'll also get a notification anytime that we post anything. And so I'm also doing a lot of vlogs there. So those are those video blogs, and you can see, my patients as they go through treatment. You can see what goes on behind the scenes at an oncology clinic. So that's really fun as well. So if you subscribe, which I would be really, really thankful if you did, you'll get notifications every time we post a video. The other thing is I have been working to create these great I think they're great. People seem to like them. These infographics. So whatever the topic is that we're talking about, I'm going to have over the course of that month. And again, for mast cell tumors, we'll kick this off probably in about a week and go through the end of April. So every couple of days, there'll be a post on the Facebook page that will talk about the cancer that we're talking about. So we just wrapped up cat lymphoma. So we just, I think, posted our last infographic yesterday or the day before, and you can find those in the album section. So they'll be in the photo section, there'll be albums. So at any point you can go back and read all about canine lymphoma or read the ones about lymphoma. And again, we're going to kick off and get the mast cell tumors one out soon. So I think that's all that I have for housekeeping. So let's get going. I have a couple of questions that were asked yesterday when I did the live reminder for this. But before the comments get too pushed down, I'm going to start with Ariel. Welcome. Thanks for joining from Pittsburgh. And so her question is, she has a dog with an intermediate grade 2 mast cell tumor over the carpus, which is the wrist, with incomplete margins, or she says bad margins. So let's just kind of overview. So, when you get your dog's mast cell tumor removed, they're going to submit it to the lab for a biopsy. And when you get that biopsy back, it's going to tell you a couple of really important things. One is the grade. Classically, we used to grade them grade 1, grade 2, grade 3, where grade 1 is the least aggressive. It's still malignant, but those were the ones that were least likely to metastasize or spread. On the other end of the spectrum are the high grade or the grade 3 mast cell tumors, and those have a 50 to 90% chance of spreading. So completely different. And then there were these middle grade, the intermediate or grade 2. And they have, depending on what study you look at, about a 50-50 chance of spreading. So that was really frustrating for pet owners and cancer docs because it was hard to predict whether or not they were going to spread. So we've done a lot. So we have other things that we can do to try to predict whether those intermediate grade 2 mast cell tumors will spread. I do recommend that you make sure if your dog has a mast cell tumor, especially if it was a grade 2 or a grade 3, you want to make sure it hasn't spread. So where do these tumors typically spread? They can spread to the lymph node. So if you have a dog with a tumor over the wrist, over the carpus, we're going to be feeling the prescapular lymph node up by the shoulder and also the axillary, which is in the armpit area. They can also go to the liver and spleen, and in most advanced cases will go to the bone marrow. This is not one of the typical cancers that will spread to the lungs, so chest x-rays are less important than it is for some of the other cancers. Most cancers in dogs and cats can spread to the lungs, but typically mast cell tumor is going to go to draining lymph nodes, liver, spleen, and bone marrow. Okay, so if your dog has a mast cell tumor, you're going to find out if it's spread. The other thing, because of that middle grade has kind of been annoying in trying to predict if it's going to spread, there's a newer grading system where it's just a high-low, where they've redefined the system, the classification system, and we kind of got rid of that middle grade, and we have a high and a low, and that has been shown to be very predictive. In general, the recommendations are that every pathologist, that doctor that looks under the microscope and grades the tumor, should be grading it both on the old system, the 1, 2, 3, and the newer system, the low high. So for Ariel, I would wonder if they did that, if it was a low or a high, because that can help. The other thing is with mast cell tumors, I'm not surprised when we have them over the leg, especially further down on the leg where there's less muscle and tissue, that we're going to get bad margins. And what Ariel means is when they looked at the margins on the biopsy report, they see cancer cells at the cut edge, which means there's still cancer cells left on the dog and increases the likelihood that her dog's mast cell tumor is going to come back. And why I say I'm not surprised is the further they down on the leg, it's harder to get clean margins. And that really emphasizes the idea of finding lumps and bumps sooner. And my cancer awareness program, which you may or may not have heard of, which is called See Something, do something. Why wait? Aspirate. And so what I really recommend, guys, for all your pet owners, dogs and cats, every month, put it on your calendar. You want to feel your dog over and your cat for lumps and bumps. And if you find something, you need to go to your vet. So the guidelines are, if the mass is the size of a pea, which is the same size of about an M&M or a Skittle, and is there for a month, I want you to go to your veterinarian and ask them to do an aspirate. You want them to stick a needle, collect some cells. And typically with mast cell tumors, we'll be able to, with that aspirate, make a diagnosis. And then we know that when they go to surgery, we need to do a big surgery. So again, we want to find them when they're pea size, because even if they are over the end of the leg, we can remove them with complete margins. So that's sort of the gist with that. So ideally, what do you do if you have a dog that has incomplete margins over the leg or the face or something like that? The best way to prevent the cancer from growing back, and Ariel mentioned this, is radiation. And radiation has been shown to be very successful to prevent these tumors from coming back. And if you look at dogs 2 years after their radiation, 90% still have tumor control. What do I mean by that? They still don't grow back. So that's great. But she's saying radiation's not an option, and it could be due to your location. Maybe there isn't a place close enough, though in Pittsburgh I do think there's a radiation, and it could be cost, because radiation, unfortunately, is not inexpensive. It also is typically daily radiation for a period of 3 weeks. So if your dog has serious heart disease or something like that, where daily anesthesia is not an option, that might be, that might eliminate the radiation option. So, Ariel, what would be the next option if you can't do more surgery and you can't do radiation? Historically, when I was a resident, we used to talk about doing amputation. I think, I'm all for amputation for like bone cancer or osteosarcomas, but I'm going to tell you, I'm not a huge fan for an intermediate grade mast cell tumor, c-KIT mutation negative, to do radiation. We can try some forms of chemotherapy to delay the cancer from coming back. It's not going to be as good as radiation, or, if it was in an area where you could do a second surgery. But again, that's what I would do in this case if surgery is not an option, and it's not over the wrist, and radiation is not an option. I would talk to a cancer specialist about doing some forms of chemotherapy, usually 6 months, in order to prevent the cancer from coming back. And we'll come back and talk about the c-KIT mutation, but I'm going to scroll down just because I wanted to keep my eye on your question. So, Ariel, hopefully that helped you. I'm not sure if you've had the opportunity to see a cancer specialist yet, but a great way to find one is vetspecialist.com. That's with an S, so vetspecialist.com, and hopefully we will throw that in the comment section as well. But I'm pretty sure in the Pittsburgh area there are some specialists, so that would be helpful as well. So, Ariel, hopefully that answered your question. The c-KIT negative part of it, so that's another predictor that we have learned probably in the last 10 or so years. And so we know about 1/3 of dogs have a mutation in a gene called c-KIT. The best comparison I can have for people is we know that some women with breast cancer have the BRCA mutation. So this is a different mutation, and we see these in some human cancers as well. But we know that dogs that have the mutation makes their cancer more aggressive. But if they have the mutation, we're definitely going to include Palladia, which is a c-KIT inhibitor, a targeted oral chemotherapy in their protocol. So that's where that helps us make that decision with that. But in general, it's better if a dog doesn't have the c-KIT mutation. But if they do, we will just make sure that Palladia is part of their chemotherapy protocol. All right, so hopefully that helped, and hopefully that was a decent overview for you guys in terms of, how we think about mast cell tumors. If they're a high-grade mast cell tumor or c-KIT positive or a grade 3 mast cell tumor, those dogs I'm automatically going to be recommending chemo, well, in most cases, but in general, going to strongly emphasize the need for chemotherapy, because those are the dogs that have a greater risk of spread. Other things that can help us, and it's not just one thing, it's often many pieces of the puzzle. So what is the grade of the tumor? Grade 3, high grade, mitotic index. And so this is a fancy doctor word for how many cancer cells they see dividing on the biopsy. And that is shown to be predictive for outcome. And if they have a higher score, I'm going to put them on chemotherapy. And the c-KIT mutation is another thing. So, these are really complicated tumors. As I said, one size does not fit all. Very treatable, but really important that we get a cancer specialist involved, especially if your dog has, one of these complicated ones. All right, so Kim, her pup's going in for vinblastine. So vinblastine is definitely a great chemotherapy drug for mast cell tumors. Some of the common drugs that you may hear talked about are vinblastine, an oral drug called lomustine, and the Palladia, which is that c-KIT inhibitor that I just mentioned. Those are sort of the three main drugs that we'll use. There are some other ones that have been shown, cyclophosphamide, hydroxyurea. I know, guys, it's completely Greek, all these new words. The other thing that helps is often, even especially with vinblastine, is we will combine that with steroids in the beginning, as long as there's no issues for the pet, because steroids, prednisone, can actually help kill these cancer cells as well, and works better with vinblastine. We see higher response rates with vinblastine when combined with steroids. So that's typically how I'll start my mast cell tumor patients out. Okay, so Kiam said after 6 vinblastines, he will switch to Palladia for 6 months. Yeah, so I usually do something very similar. I usually do 6 vinblastines over the first 2 months. So I do weekly for 4 weeks, then 2 at 2 weeks. That brings us to the end of 2 months, and then I will switch them to Palladia for about 6 months. So similar, and again, you'll see some variation in protocol, but that's something that I agree with. Scrolling up, Jennifer, will you be covering cat mast cell tumors? Not this month. Probably we should do a separate one. In general, cat mast cell tumors of the skin tend to be more benign than of the dogs. There are a few rare cases that can be malignant. The ones that are internal in cats that are in the GI tract, the spleen and the liver are more aggressive. And actually, I'm treating a kitty named Cuddles, a gorgeous, almost 20-pound Maine Coon kitty that has it in those locations. So those kitties definitely get chemo. But Jennifer, sorry, if we have time, I'll come back. But we'll probably have to do cats as a separate session. But I'll try to come back to it. So Ariel says, thank you. Listen to the whole day of your lectures at the PVMA State College. Awesome. And I'll be at Western Pennsylvania this Sunday if you're interested in that conference as well. That's a little local one, so that should be fun. Heather, one of my girls, low grade 2 tumors, had c-KIT pattern 2. Does this mean it was negative or positive? So that's great, Heather. So Heather is asking a question. So when we submit a mast cell tumor panel, it's called a prognostic panel. We get a couple of different things on the full panel. And there's 2 things. There's 2 ways that we look at c-KIT. One is whether or not they have the mutation, and they look for it in 2 areas of the gene, so exon 8 and exon 11. And so that's where you get the positive or negative. And then they look at the pattern, where in the cell the c-KIT is localizing, and that has shown to be predictive as well. And pattern 2 is intermediate. So if you want it on the report itself, or you should probably go back or ask your vet to look at the report, because the c-KIT mutation status is separate. And depending on the lab, so the main 2 labs that run it are Michigan and Colorado. Some of them sort of commercial labs will send them there, but they should comment about the mutation separately. If not, you should be able to go back, and if it wasn't requested as the first part of the panel, you should be able to have that added on. So, and I think the c-KIT mutation status, whether it's positive or negative, is more important than the pattern. Some of the other things that are in that mast cell tumor prognostic panel are the Ki67, so Ki67, and something called pCNA. And basically, these are just different ways of measuring how active these cancer cells are dividing, how quickly they are turning over. And we just measure different parts of the cell division cycle. So, and that score has also been shown to be predictive. And I will have some dogs that have c-KIT mutation negative, but their other scores are really, really high. And so I may recommend chemotherapy in those cases. So again, one size does not fit all. It's not as easy as like, oh, you have this, you're definitely going to get chemo in general. There's going to be some variations from case to case. So I think it's really important that, these are ones where I think, you need a cancer specialist, and hopefully there'll be one in your area, because I know there's only 400 of us in the US and Canada, so it can be hard. But definitely check out vetspecialist.com. You can put in your zip code and see if there's a specialist. And if not, ask your vet, or ask your vet to maybe consult with an oncologist. But, that would be, where I would recommend that you go, is ask your veterinarian, what do we do for this confusing cancer case? Who do you recommend that I go to? But again, definitely, guys, feel those lumps and bumps in your pets, and get an aspirate if you find a lump or bump. And, I have had dogs come in with 4 masses that all look the same, and 3 of them will be mast cell tumors, and the other one that look just alike, is not a mast cell tumor. So I can't look at a mass, you can't look at a mass, your vet can't look at a mass and know what it is. We have to do these aspirates. And that's just sticking a needle in, extracting some of the cells, we put them on a microscope slide, and we look at it under the microscope. So again, it's a really simple, quick turnaround test. And again, mast cell tumors are usually easily diagnosed with these fine needle aspirates. So what does a mast cell tumor look like? In general, it's funny, veterinarians call these the great impersonator because they can look really variable. In general, the classic mast cell tumor is hairless, it's raised, sort of a pinkish thing. When you stick a needle in it, sometimes it releases histamine, which is an inflammatory substance, and they get bigger and smaller. Sometimes if your dog has one like over an area where there's not a lot of cushion and he sits down on a hard floor or tile, the mass will get bigger and smaller. And that can really be confusing, right? Because you're like, well, if he had a tumor, it wouldn't be getting bigger or smaller. But again, it's usually not the tumor growing and getting bigger, it's this inflammatory response, and then it gets absorbed back in. But some of them will have hair, some of them will be squishy, some of them will be firm, some of them will be freely movable, some of them will be deeply attached. So again, if you find a lump or bump on your dog, go to your vet, stick a needle in it. Again, see something, do something. Why wait? Aspirate. Mass is the size of a pea, been there a month, go to your vet, and let's find out what it is. Okay, so Paula has a friend that has a dog that has nasal cancer that's afraid to do anything. So Paula, it's a great question. I'll come back at the end. I'm going to try to focus on mast cell tumors just because, we're trying to keep these topics specific. I know looks like there's a couple of questions about hemangiosarcoma as well, or maybe osteosarcoma. So again, I'm going to stick to mast cell tumor at least for the beginning part. It just makes it easier for people. Lynn is weathering the nor'easter with you in Rhode Island. Glad power came on. So we didn't really get hit this time as bad, but this is our 3rd nor'easter in like 2 or 3 weeks. I flew through. I can't believe my flight came in from Vegas from Western Conference and landed in this. I really thought that might be my last flight. That was scary. Samantha just removed a low-grade subcutaneous mast cell tumor. Great question. From my Noel's abdominal area. Doctors suggested only surgery. Path said low grade, but bad margins due to sitting right over the muscle layer. Peeled right off. Okay, so in general, so most of the mast cell tumors are of the cutaneous or the skin layer. There are some that are of the subcutaneous, so that layer just below. Recent reports suggest that the subcutaneous ones tend to have a lower spread rate. So I would be less concerned about the risk of spread, but I would still check with an abdominal ultrasound at least to make sure that there's no spread internally. But I do worry if they had incomplete margins again, that this is likely to recur. So, and I have to tell you, sometimes if your vet, thinks that they can't get margins, this would be one that maybe you want to see a board certified surgeon, and you can use that same website to find a surgeon, vetspecialist.com, because sometimes a board certified surgeon is more comfortable doing a more aggressive surgery to prevent the tumor from coming back. If not, radiation, though, again, it depends on the layer or the area. This would be one where you need a radiation that's not going to penetrate those radiation beams deep because it might be organs underneath, or default to chemo. But again, in general, if you have an incompletely resected mast cell tumor, whether it's cutaneous or subcutaneous, I think about another surgery first as my best option to prevent recurrence. And if it's in a location where that's not possible, radiation. And then my third next choice would be chemotherapy. Once the main mast cell tumor is removed and there's no detectable, visible mast cell tumor, I do not typically keep them on antihistamines. If they have metastasis or spread, or you have a big mast cell tumor that can't be removed, or you're waiting for that big mast cell tumor to be removed, those are the ones that I will keep on antihistamines. But for one that's, as we say, microscopic, I don't usually keep them on antihistamines. They don't usually need it, in my opinion. All right, working on a cold as well. So guys, excuse me as I take a quick sip of tea. And so Lisa, also from Pennsylvania, no experience with mast cell, but lost one of her dogs to hemangio, which is, so I plan on talking about hemangio probably in a couple of months. I think after we do mast cell tumors, we're probably going to do bone cancer, but we could, it's up for debate. So we could do a poll as well. And then multiple myeloma, which is actually an uncommon cancer in dogs, but very treatable, actually has a better prognosis than lymphoma in dogs, which is different than people. And one of her dogs is in the Golden Retriever Lifetime Study. So this is great. I'm really excited about this. So the Morris Animal Foundation, which is a great, great organization, they are following over 3,000 Goldens from puppy through their life. And then, you know, because Goldens are unfortunately a breed that we see a lot of cancer in, not just mast cell tumors and lymphoma and hemangio. So thank you, Lisa, for enrolling your dog in that study. That is really, really great. And I'm sorry for, you know, all of your experience with cancer. It sucks and it never gets easier at all. All right, just scrolling down. Is everybody still there? Is everybody enjoying this? Is this helpful? You know, please give me a shout out that, you know, that you're enjoying this and that I'm hitting the points that you guys want me to hit. I also have a couple of questions I don't want to forget from yesterday that people, put before. So if anybody's here, go ahead and throw in the comments. Seeing some likes, so that makes me happy. Marilyn says, or Marlin, sorry if I mispronounce. Hi, Heather. Thank you, thank you, thank you. Thank you for the love, Margaret. So Marlin says, do you always recommend antihistamine and Dex SP at the time of the aspirate? So I'll be honest, you know, there's plenty of dogs that we aspirate little mast cell tumors. We don't know that they're mast cells because you can't look at them and know what it is. And I don't always I usually do not give steroids. I usually will just give some Benadryl, and I'll usually give some IV and some intramuscular, so half and half. That's personally how I do it. Or if I give a mass and the tumor starts to, you know, release the histamines, I will give some Benadryl then. But it's, you know, the ones that I will pre-medicate if I really suspect are the big, you know, way too big in my experience. You know, they're the size of a softball or even bigger. And the high grade ones tend to be more fast growing. They tend to be ulcerated. They tend to be more inflamed. They look angry when you look at them. Those are going to be the ones that I give an antihistamine. It's never wrong to give an antihistamine. But again, if your dog had an aspirate of a, you know, relatively small mass, the size of a penny or the size of a pea, I hope, and they didn't give Benadryl and it came back mast cell tumor, don't worry about it because most of these little ones don't need it. But again, when in doubt, if we're suspicious of a mast cell tumor, I will give Benadryl, but not always. And like I said, there are some dogs that I'm really not suspecting they're going to be mast cell tumors. And then we get back that they are, and they did fine without the histamine. But again, it's never going to hurt to give an antihistamine if you're suspecting it. And you are welcome, Samantha. My unexpected day off. Yeah, so as long as we're wrapped up by the time my boys get home, I am good. And so far my nose is cooperating with this, so we're good there. Lynn also has a girl in the Golden Retriever study. That's great, guys. I'm really, really excited, and I'm very excited. You know, the hard part about a lifetime study, it's going to take them a long time to collect all this information, but they are doing some interim analysis of the data, and really, really excited. Yeah, and she's lost 5 Goldens to cancer. So, you know, it sucks because Goldens are such a fabulous breed, but we see way too much cancer. Thank you, Michelle. I appreciate it. All right, so let's see what questions I may have missed. So Denise Williams, my lab has had 6 low grade 1. She said 6 low grade 1 or grade 2 mast cell tumors over the last 2 years. First one had the panel, exon 8, I'm going to say, was at positive and the high mitotic index and incomplete margins. Had second surgery, got complete margins. Does the first mast cell tumor panel overall? That's a great question. I'll come back to that. It did not come back, but 5 others since. No chemo was done for the 6 that they were removed. Okay, so, this is great, great, great question because it allows me to hit on a lot of good points about mast cell tumors. So, some dogs will have one mast cell tumor, be low grade, cut it off, not a big deal. If they get another mast cell tumor a year later, we're going to do surgery again. It may be a different grade. So ideally, not ideally, you need to submit every mast cell tumor. If your dog has another one a year later, 6 months later, it should be submitted. And they can be different. So you can have one that was c-KIT mutation negative and all the scores were low, and the next one can be very high. And again, the grade on that first biopsy report does not always predict that mast cell tumor panel. And that is why it was developed, because we knew that the grading system, both grading systems, whether it's the 1, 2, 3 or just the low high, are missing out on some things. So again, ideally, you want to definitely, each time you take it off, it should be submitted to the lab. And if you can, to do the mast cell tumor panel. And the reason I kind of hesitated like that is they're not inexpensive. If I have a dog that I'm taking 3 mast cell tumors off at one time, I'll submit them all for biopsy, and then I'll pick the one that's most aggressive looking on the biopsy report and do the mast cell tumor panel on that. So I'm trying to crystal ball which is the one that I think is going to be likely the one to wreak the most havoc potentially and maybe need chemo. So the highest grade one, the one that had the highest mitotic index, or some of the other characteristics on the biopsy report, those are going to be the ones that I'm going to do the mast cell tumor panel, because I'll be honest guys, it's not practical to do it on all 3. But if you had a dog that had one this year and then 2 years later, absolutely, please definitely submit it for biopsy and then do another panel. So we know about 10 to 15 to 20% of dogs will develop multiple mast cell tumors over the course of their life. Boxers are a breed that we see it. Pugs are another breed that we see with multiple mast cell tumors. Boxers tend to have low grade ones, but again, I've seen boxers with high grade ones or grade 3 ones. So again, 10 to 15 to 20% of dogs will develop multiple mast cell tumors. If I have a dog that's starting to cluster them, and what do I mean by that? Develop multiple mast cell tumors over a short period of time, I hesitate to keep doing surgery because that's a lot of surgery. And it seems like, unfortunately, Denise, your dog has this potential, this propensity to develop multiple mast cell tumors in a short period. If you said it was one a year over 6 years, I'd say, yep, let's do surgery, submit them, and then decide, treat one individually and make sure each one doesn't have any risk factors for spread. But when I start to see that, would you say in the last 2 years, you've had 6 removed, I would wonder, especially if I have a dog that has multiple mast cell tumors over a period of 6 months, roughly, I would think about doing chemotherapy instead of multiple surgeries. The jury is still out, I'll be honest. You can probably put 4 oncologists in the room, ask them what they would do, and maybe get 3 to 5 opinions. So again, it's not a consensus for sure what to do with dogs with multiple mast cell tumors. It's not wrong to remove them, especially if we can find them when you're small. But again, you get to a point where how many times are you going to do surgery? But again, each should be submitted. And again, just because the first one had, c-KIT mutation negative, the other one may not. And the mitotic index on that first one was 9. And most studies show greater than 5 to 7 is going to be in the more aggressive. With that said, so in one really good study, if it was higher than the cutoff, the dogs had a survival time, regardless of grade, about 3 to 4 months. And if it was lower than that, their survival time was 2.5 years. And you're telling me that your dog had that 2 years ago with a high mitotic index. So just realize, guys, that no predictor is ever going to be 100%, and statistics will never predict your dog. And as I showed in my Facebook post today on one of my wonderful patients, Nanook, different cancer, but came to see me with metastatic cancer a year and 4 months ago. Sometimes, we're wrong and they live way longer than we could ever imagine. So that is what we're always hoping for, as I say, statistics busters. So, yeah, so I would think about maybe chemo for your dog, Denise, especially if we're starting to see all those mast cell tumors together. Let's see. Nala has had so many pop up. I just keep her on Benadryl in case I overlook one. Yeah, whether or not, that's not going to, in general, prevent the tumor. It's just going to prevent the histamine release. So we have another boxer with hemangio. So yeah, and again, guys, that's a tumor, a common tumor of the spleen. One of the tougher tumors, in my opinion, to treat. It's treatable, but not as treatable as some of the other cancers. So we're definitely going to spend a whole hour talking about hemangiosarcoma in the future. So if you're not doing, so Debbie Fleshman wants to know, if you're not doing chemo or radiation, how long should your dog remain on the Tagamet Benadryl? So I don't have a lot, and then she asked about a supplement. I don't have a lot of experience with that supplement personally, so I don't typically use that. But again, if it has been removed with complete margins or incomplete margins and there's no evidence of metastasis or spread, I do not usually keep them on Tagamet Benadryl or things like that. So it really depends if there's still tumor there. If there's still tumor there or if there's spread, I'll keep them on that indefinitely. But again, I don't usually keep them on once the tumor has been removed. All right, I think if I missed your question, I'm scrolling back up, maybe put it again back in the comments, but there was a couple of questions I want to make sure that we get to that people put in yesterday. So let's see. Okay, so Katie Shields wanted to know, what is the most effective treatment for visceral mast cell tumor with no external tumor? And is it typically painful? What diet is best? So mast cell tumors in general, and I'm gonna go back to the skin form before I answer your question, Katie. And she sent me a picture of her gorgeous 3.5-year-old Labrador, just looking so adorable. And if anybody has ever, followed any of my stuff or is on my Instagram page, you'll know that I'm a Labrador lover. We have my 8-year-old Labrador Matilda, who just is still recovering from her cruciate TPLO surgery, and Penelope, the almost 1-year-old yellow Labrador. So I have a soft spot for Labradors. So in general, the ones that are on the skin, they're not painful, but they can be itchy. And so dogs will often scratch at them, which will make them get bigger and release those histamines and sometimes heparin, so they can bleed a little. But in general, they don't tend to be too painful. It's more probably an irritant than something that's pain. The histamine, if a dog has a really big mast cell tumor or mast cell tumors internally, whether it's primary or it's spread, they can release a lot of histamine. There will be extra histamine in the blood, and that can actually irritate the stomach and lead to stomach ulcers. And that's often why we keep these guys on antihistamines and then something like Pepcid or Omeprazole as a stomach protectant to protect them against ulcers. So if your dog with mast cell tumor is vomiting or not eating well or vomiting blood, it could be because they're starting to get stomach irritation or ulceration. In dogs, which is different than cats, like I mentioned earlier, it's uncommon to have it just in the internal organs like liver or spleen. Usually you can find a primary, a big, usually one of those hot grade 3, high grade ones. But there are patients that I have had as well where it's just internal, again, with the most common places being the liver and spleen. For those, if it's like just in the spleen, we may think about pulling the spleen and then doing chemotherapy or seeing if they respond to chemotherapy, monitoring with ultrasounds and aspirates, and then pulling the spleen after that. So it's going to be a little bit variable. Through the liver, it's usually diffusely throughout the liver, so it's not usually something you can cut out the whole liver. It's not usually in one lobe. So that would be one chemotherapy. I'd find out if they have the mutation, and that would allow me to pick their chemotherapy protocol. Is there going to be Palladi in it, or some of the other drugs that we talked about, vinblastine and lomustine? So she says, as of March 12th, which was yesterday, it was progressive and they switched to lomustine. So one thing that would be worth figuring out is, and you can do the mutation, just the c-KIT mutation on an aspirate, but they'd have to go back and re-aspirate if they didn't get a biopsy of it. So you can figure out if they have the c-KIT mutation from an aspirate, you don't need a surgical biopsy. But it's a good option. I like the lomustine. That's a good drug for mast cell tumors. And then Palladi would be something. And then again, there's a few other uncommon ones that we can use as well. Katie, I'm wishing you and your beautiful Labrador good luck, and hopefully you will keep us updated. And trying to see if she's a he or she. Hopefully she will do well. She asked about diet, and there was a couple of other questions about that as well, so we will get back to it. Denise is working. Just hopefully post her question. We had a question, Heather had a question about multiple mast cell tumors and treating them as separate primary lesions or all in different locations. And this also goes back to the other question about Denise, who had the dog with multiple mast cell tumors. So especially dogs with multiple mast cell tumors, but I do recommend that they have staging. And so again, if it's in an area that there's a draining lymph node, so again, in the front leg, we're going to think about the shoulder and the armpit and the back leg behind the knee. I'm pointing to them like you guys can see them below the screen. But, so if it's down by the ankle or the digits on the back leg, we'll aspirate the lymph node behind the stifle or the knee or up in the inner thigh. So we want to feel for and aspirate draining lymph nodes and do that ultrasound to look in the liver and spleen and potentially aspirate the liver and spleen. Bone marrow aspirates are not wrong, but it really depends on the case because you have to sedate them and it definitely adds to cost, but they can spread there. So the ones that I'm likely to include a bone marrow aspirate would be the higher grade ones or some of these other more aggressive ones. Those would be the ones that I'm typically, or if there's blood work changes on the CBC. But I'm not doing as many bone marrows in the lower grade ones. But if you're, again, it depends for me with a dog with multiple mast cell tumors, how many they are developing in what time period. So if you have, I had one dog named 20 that I kid you not, and she came in with over 10 mast cell tumors. So I had her vet remove 2 of them. We submitted them. We did the mast cell tumor panel on one of them. And that was one of the first dogs I put on Palladia. So this was probably back in, 2008 or 2009. So Palladia has been on the market now, I want to say for about 10 years. So it's definitely a safe drug. This is an oral drug that you're going to be giving at home under your veterinarian or hopefully your oncologist direction. And so, usually we're giving it every other day or 3 times a week. So it's a good drug, but it's a chronic therapy that you're going to be using at home. Lomustine is a different one. That's an oral one that I usually give in the clinic after I check blood work in-house, and then we administer it. And that's usually given every 3 weeks. Vinblastine can be given weekly to every other week. So the protocols, what your dog may go on if they need chemotherapy, can really vary depending on what your cancer specialist decides what drugs they need and, the interval that you can get there, to be honest, because that will depend as well. But again, we are hoping that the lomustine will work. And then again, for Heather, it depends on how quickly your dog is developing the multiple mast cell tumors. Again, if they're 1 a year, just cut them off, submit them, hopefully get clean margins. Find them when they're small because you're feeling your dog and you're aspirating them so we know what they are. And guys, the point of the aspirate is if it's a mast cell tumor, the surgery needs to be bigger. Your vet needs to get bigger margins, a bigger rim of normal tissue around the cancer to prevent it from coming back. That's what we mean by clean margins. If the tumor, if they aspirate it and it's something benign, they can do a minimal surgery, or maybe you're going to wait and not take it off right away. So again, the aspirate's going to allow your veterinarian to prepare for that surgery, because what we would really like is the first surgery to be the only surgery. We don't want to have to go back and do radiation or go back and do a second surgery, which we call a scar revision, where they're cutting around the scar to prevent the cancer from coming back. So, again, it's really important that you let your vet do that aspirate so we know what it is before your pet goes to surgery, because I would really love to find these small and make the first surgery the only surgery, and that's only going to work if we aspirate them and find out what they are. Hey, Melissa. So one of my co-workers, my old hospital manager from my practice in the Hudson Valley, just joined on. So I'm waving. It's great to see you, Melissa. If you're not doing chemo or radiation, we did that question. And then Lisa, my pug developed mast cell tumor. So, I did that because unfortunately we see pugs between her toes 2 years ago. It was removed without clean margins. She removed electrochemotherapy. Yeah, and so I think there might have been another question about electrochemotherapy up there. So this is a good alternative for these cases where we can't cannot get clean margins. It was pretty uncommon, but there's a good, I don't have it at my practice, but there's a great, a good number of practices that are slowly adding it to it. Your vet or your oncologist needs to be specialty trained, but it can help, deal with those incomplete margins and prevent recurrence. And toes, I mean, that's a crazy hard place to get clean margins. I had another pug that I vividly remember that had a bloody tumor, but, mast cell tumor between his toes that couldn't be do surgery and did not respond to chemo. And that's another good point, that in general, a non-surgical mast cell tumor is not going to respond great to chemotherapy. So we tend to use chemo for those high-risk cases that are high risk of spreading after the tumor has been removed, hopefully with clean margins and or radiated. So hopefully we're not going to need to do chemo in most cases. I have had some cases where they come in with a mast cell tumor over the carpus, over the wrist, or over the ankle, and we'll use chemo before surgery to shrink it, and that allows the surgeon to then go and get margins, and then maybe we will need chemo afterwards depending on the grade and the prognostic panel. Lynn asks, is there a standard measurement for clean margins? And that's a great question. So the old, do I have my calipers here? Oh my goodness, where are my calipers when I need them? Be right back. Where did I go? Okay, I'm back. So guys, you want to, we're now actually, I'm giving out these calipers at lectures, and we are going to be selling them on my website for veterinarians as well. So these are calipers, and the reason you need them is we need to know what margins are. So what do I mean by that? So in general, you want to have 2 to 3 centimeter margins. And we're Americans and we think in inches, right? So I'm going to show you what 3 centimeters is. So this, guys, this space right here is 3 centimeters. So if your dog had a 2 centimeter tumor, okay, and we want to get 3 centimeter margins on both sides, that means they should come home with an 8 centimeter incision, right? So 8 centimeters. So they need a really big incision. So again, that's the whole point why we need to find these when they're really small. If your dog has a 4 centimeter mast cell tumor, right, we need to add another 6. It needs to have a 10, sorry, I have the measurement on my side, a 10 centimeter incision there. So again, zeroing this out. Let's do that again. So there we go. So we need to have 10, so again, this is the whole point of why we want to find these when they're really small. So if they're a centimeter, the incision's still going to be 7 centimeters, right? So some of the newer studies are actually suggesting smaller tumors that are lower grade, you can get away with like 2 centimeter margins. When you remove a mass and you drop it into the formalin, which is what we send it to the lab to, the margins, because there's no longer the tissue being held by the body, it will shrink a little. So when I'm looking at a biopsy report for the margins around the tumor, I'm usually looking for at least 1 centimeter or 2 on that. Again, if it's a higher grade, I'm going to want more tissue. And then deep underneath the tumor is not going to be 3 centimeters because that would be crazy, right? So we want a tissue plane deep. And you don't want your vet to go back in and scoop out the next tissue plane, but usually it's a muscle layer deep. So they want to go 1 layer deep because in general, the mast cells don't invade through the tissue planes. So again, smaller tumors in general, we can get away with smaller margins, and they're lower grade, we can have slightly less. So again, in general, you want 2 to 3 centimeters around the tumor and a tissue plane deep. The problem is we don't really know the grade of the tumor before we remove it, right? So you're going to want your vet to try to get 3 centimeters around, tissue plane deep, and then, if it's a lower grade tumor, in general, we'll be happy with, slightly less margins, 1 to 2 centimeter margins. So that's going to be the standard. So these calipers that I have here, this is similar to what I have in my practice. But basically, we really need to be measuring these tumors. And we also have some pen calipers and some plastic calipers, which are a little less expensive, and those will be available on my website shortly. So if you or your veterinarian wants, calipers, it's great. And I would love for every pet owner to have calipers so we can measure the lumps or bumps. And again, we really want to find them when they're small. So great question, Lynn. Thanks for asking that. Margaret is asking about, so hemangiosarcoma. So yeah, again, so maybe next month, is going to have to be hemangio because that is unfortunately a common tumor that we see. There's obviously lots of questions about that. So that is that malignant blood vessel tumor that we tend to see in spleens in dogs. In boxers, they're one of the breeds, Goldens, Shepherds, Labradors, but we pretend no Labradors because I have a Labrador. The only other question before we wrap up, kids, I'm thinking about my kids coming home soon, is so there's some questions about diet. And so, diet is controversial in the sense that, people wonder if there's an anti-cancer diet. And the idea originally is that it was sort of an Atkins-like diet. So something that's higher in fats and higher in proteins and lower in carbs. And cancer cells require sugar and carbs as their nutrition source, and that's their only nutrition source. So the idea was, should they be on a high fat, high protein diet? And you'll see a lot of the cancer diets sort of around that. In the co-author of my book, The Dog Cancer Survival Guide, there's a cancer diet. One of the things that I think is super important, a couple of kind of take-home messages. We know that omegas, fatty acids, are really important, and they're good for dogs' hair coat. They're good for joint disease. There was just a study that was just published in JAVMA, which is the Journal of American Veterinary Medical Association, about dogs post cruciate surgery and the benefit of being on omegas. And we do think that there's an anti-inflammatory and anti-cancer property to them. So omegas would be something that I would think about supplementing their diet with. The other thing that I like is fruits and vegetables. So we know that there's a lot of phytochemicals and these other good components in fruits and vegetables. We know one of the lifestyle risk factors for cancer is a diet low in fruits and vegetables. And we know a lot of these natural plant compounds can help promote apoptosis, which is cell suicide, which is of the cancer cells. So those are the cells that we would like to commit suicide, but they just keep living forever. So, I think it's helpful to add healthy fruits and vegetables to your pet's diet. There's a study looking at transitional cell cancer, carcinoma, in dogs. They looked at Scotties, which are a high-risk breed. They're 18 to 19 times more likely to get this bladder cancer. And dogs that had more fruits and vegetables in their diet did better. Again, adding fruits and vegetables. Obviously, you need to know the ones to avoid, like onions, raisins, grapes, avocados. There are certain ones that you don't want to add to their diet. But what I think is more important is a healthy diet. So whether it's home cooked, I do believe home cooked are best, but I can't home cook for my dogs as much as I love them. I'm a working mom, right? So there are good other alternatives. People ask me what my dog's on. There's plenty of other, great pet foods out there, but I'm a big fan of Honest Kitchen. I have the one that has the protein in it, but there are other ones. If you are home cooking, you can't just cook, and you guys know this probably, right? You can't just give them meat or things like that. It has to be a well-balanced diet. So there are websites like Balance It, which can help you come up with a homemade diet or consult with a nutritionist. And so some of my dogs that have other diseases going on, we're going to have them consult with a nutritionist and come up with whether a commercial or something they can add and supplement with it. So again, I like supplements, a healthy diet. I like the omegas. Some of the supplements I like for my patients is I like the Asian mushroom. So Canine Immunity Plus is an immune boosting mushroom. And then you guys have heard this before, I love apicaps. If your dog is on steroids for their mast cell tumor, you need to lower the dose of apicaps until they're off. But again, those are the things that I think about. I think diet's important for sure, but I don't want people to feel that they have to home cook because that's a big time investment, and we're all pretty busy people, even though we love our dogs. So again, those are the things that we can think about. And then before we wrap up, Patricia, what are your thoughts on removing lipomas in a dog with previous mast cell tumor? I mean, in general, you don't need to remove lipomas, like jump to doing their removal the way that you would with a mast cell tumor because they're benign, but it would be great if you're measuring them at home and you're making sure that they're not getting too big over a short period of time, because it's hard to look at a mass and feel a mass and remember how big it is. So what I want you to do is measure these masses at home, and every once in a while someone will tell you about a lipoma that had mast cell tumor inside of it. So if you have a tumor that is getting bigger, even a lipoma, very quickly, or bigger, it's in an area where if you let it get too big in the armpit or over a joint, surgery is going to get complicated. Remove it, and don't let your vet, throw it out. You got to submit it as well. But dogs that have had mast cell tumors can still have lipomas. But again, what I think is really important is you're really proactive. And so one of the things that will hopefully be on my website soon is what I call a skin map. And what I want you to do is have calipers at home, measure your dog or your cat's lumps or bumps, and mark where they are in your dog, because right, left, it's hard to remember where they are and what size they were. And so if, a lipoma again is growing more quickly than we would expect a lipoma to, which should not be growing that quickly, maybe it's time to get it off and submit it and make sure there wasn't something else in it. Or again, some lipomas can just be troublesome even though they're benign, because because they're in an area where they're going to get bigger, it's going to be more difficult. All right, guys, so we're just coming up on an hour. I think my voice is starting to go a little. I really hope that you guys found this useful. Again, the playback will be on YouTube and on Facebook. In a day or two on Facebook, it can be hard to find these playbacks. But again, if you go to my YouTube channel, another plea, you can find all of the old Q&As there, all of my vlogs. I have videos of dogs getting chemo, celebrations, just lots of helpful things. So if you're wondering what it's like when your pet's getting chemo behind the scenes, you're welcome, Margaret, wishing Tyson good luck. Again, hopefully we will get hemangiosarcoma on the calendar soon, and I'm sorry that you're dealing with all of that. But again, guys, subscribe to the YouTube channel. Thank you. Another thing you can do is share this with your friends. If you have another group, of owners that you think this may be helpful, please share, tag your friends. Thank you for joining me. I really appreciate the time that you take out of your day. I hope you find this helpful. Like I said, depending on, we'll probably do a poll, but I'm thinking if you guys want, we can do another Q&A on mast cell tumors, or we may hop to another topic. Again, the next one will be Thursday, April 19th, 9 p.m. Eastern, 8 Central, 6 p.m. on the Pacific. Remember, there's lots of infographics. The mast cell tumor infographics will start to come out in the next week or so. Thank you, everybody. I really, really appreciate you guys taking the time out. I hope this was helpful, and I will see you guys all soon. Again, thanks.